The truths about blood pressure that increase the risk of stroke. High blood pressure, the ticking time bomb inside our bodies. A silent force that tightens the circulatory system day by day, damaging tiny blood vessels and vital organs without you even knowing. That's high blood pressure, a condition quietly harming your cardiovascular system every single day. Often called the silent killer, hypertension typically shows no clear symptoms in its early stages. A person may feel perfectly healthy, while elevated blood pressure is secretly damaging artery walls and increasing the risk of stroke, heart attack, heart failure, and kidney failure. What's deeply concerning is that many, especially older adults, Asian Americans, and African Americans, still don't fully recognize how dangerous this condition can be. Even with regular medication, small lapses like eating too much salt, prolonged stress, or not monitoring your blood pressure can lead to serious consequences. Understanding high blood pressure is one of the most essential steps to taking control of your health, especially after the age of 50. The truths about blood pressure that often mislead us. Truth number 1, understanding blood pressure readings. Blood pressure is the force exerted by circulating blood against the walls of blood vessels, primarily the arteries. It is measured in millimeters of mercury mmHg and is expressed using two separate numbers. Systolic pressure, top number. This measures the pressure in your arteries when your heart contracts to pump blood throughout the body. It represents the highest pressure in a heartbeat. Diastolic pressure, bottom number. This measures the pressure in your arteries when your heart rests between beats and refills with blood. It reflects the lowest pressure in the arteries. A common and potentially dangerous misunderstanding is when someone only mentions their systolic pressure. For example, my blood pressure is 120. That number means little without the diastolic value. For instance, a reading of 120/95 mmHg indicates isolated diastolic hypertension, which requires attention, whereas 120/75 mmHg is considered normal. Both numbers are important. Systolic pressure shows how hard your heart is working to pump blood, while diastolic pressure reflects the resistance in your arteries when the heart is at rest. Blood pressure is not a fixed number. It fluctuates depending on the time of day, posture, emotional stress, and physical activity. A single high reading, especially in a stressful setting like a doctor's office known as white coat hypertension, does not automatically mean you have high blood pressure. A diagnosis requires multiple readings under calm, resting conditions. That's why doctors often repeat the measurement or recommend at-home monitoring. Understanding these numbers is the first essential step toward managing heart health effectively. Truth number 2, blood pressure categories and what they mean. Knowing your blood pressure numbers isn't enough. You also need to understand where those numbers fall on the health risk spectrum. Medical organizations like the American Heart Association (AHA) and the American College of Cardiology (ACC) classify blood pressure into specific categories. These classifications help assess your health risks and guide treatment, not just label your blood pressure as normal or high. Blood pressure categories. Optimal blood pressure, 120/80 mmHg. This is the ideal range and is linked to the lowest risk of cardiovascular disease. Example, 110/70 mmHg. Normal blood pressure, 120/129 80/84 mmHg. Still within a safe range, but it's important to maintain a healthy lifestyle, especially when nearing the upper limits. High normal blood pressure, 130/139 85/89 mmHg, previously called pre-hypertension. This range signals a higher risk of progressing to true hypertension, especially if other conditions like diabetes or kidney disease are present. Lifestyle changes are essential, and in some cases, medication may be considered. Hypertension. 40 to 90 mmHg. or in some guidelines. 130. mmHg. Stage 1. Hypertension. Systolic 130, 139, or diastolic 80, 89 mmHg, AHA, ACC guidelines. Or 140, 159. 90 mmHg, older guidelines. Requires lifestyle modification and possible medication if risk factors are present. Stage 2 hypertension down. Systolic 140 or diastolic 990 mmHg, AHA, CC, or TAM 106 mm. Older guidelines. Almost always requires medication, often a combination of drugs, along with lifestyle changes. Hypertensive crisis. 180 van, 120 mandintana. This is a medical emergency that requires immediate care to prevent organ damage. Clearly, identifying which category you fall into isn't about labeling. It's about helping you and your doctor choose the right strategy to manage your blood pressure and protect your heart health effectively and in a timely manner. Truth number 3. The silence of blood pressure before the storm. The most frightening truth about high blood pressure is its silence. You may feel completely healthy, active, and full of energy, while your blood pressure is dangerously elevated, laying the groundwork for a catastrophic event like a stroke or heart attack. While some people with severe hypertension may experience symptoms like intense headaches, dizziness, nosebleeds, shortness of breath, blurred vision, chest pain, or confusion, these signs are not reliable indicators. They typically appear only when blood pressure has reached dangerously high levels. Waiting for symptoms is a gamble with your health and your life. The only reliable way to detect and manage hypertension is by measuring your blood pressure regularly. Adults should check their blood pressure at least once a year, and more frequently if they have risk factors like underlying conditions, previous high readings, or a family history of hypertension. Home monitoring is also a valuable tool for early detection and proactive management. Truth number 4. The lifelong battle called blood pressure control. For many people with hypertension, especially those who require medication treatment, is a long-term commitment, often lasting a lifetime. This can be difficult to accept, especially when you feel completely healthy. But it's important to understand. Blood pressure medication is not meant to cure the condition, it's meant to keep your blood pressure stable and prevent dangerous complications. These medications work in different ways to control blood pressure. ACE inhibitors. ARBs and calcium channel blockers help relax blood vessels so blood can flow more easily. Diuretics help the body eliminate excess salt and water, reducing blood volume. Beta blockers slow the heart rate and reduce the force of contraction, lowering pressure inside the arteries. All of these medications are proven effective, but only if taken consistently and exactly as prescribed. A dangerous misconception is stopping medication once blood pressure has stabilized. Many mistakenly believe that normal readings mean the condition is cured. In reality, discontinuing medication without a doctor's guidance can cause blood pressure to spike, sometimes even higher than before, leading to serious events like stroke or heart attack. Hypertension is a chronic condition that cannot be cured, but must be managed long-term, much like diabetes requires continuous blood sugar control. Treatment is not just about taking pills. Patients must work closely with their doctor to monitor how the medication is working, adjust dosages if needed, and equally important, maintain a healthy lifestyle, which is the foundation for long-term blood pressure control. Truth number 5, uncontrolled high. Blood pressure wreaks havoc throughout the body. While stroke and heart attack are the most well-known consequences of untreated high blood pressure, its damaging effects extend far beyond the heart and brain, silently harming multiple systems in the body. Arteries. High blood pressure accelerates the process of atherosclerosis, causing blood vessels to become stiff and narrow due to plaque buildup. As a result, blood flow is restricted, leading to blockages and weakening of the artery walls. This can result in an aneurysm, a bulging, weakened area of an artery that may rupture at any time with life-threatening consequences. Heart. The heart must work harder to pump blood against the elevated pressure in the arteries. Over time, this strain causes the heart muscle, especially the left ventricle, to thicken and enlarge, a condition known as left ventricular hypertrophy. This makes the heart less flexible and less efficient at meeting the body's demands, eventually leading to heart failure. Narrowing of the coronary arteries, called coronary artery disease, is also a common outcome, raising the risk of angina and life-threatening heart attacks. Brain. The brain is highly sensitive to changes in blood flow. High blood pressure is a leading cause of stroke, which can occur either from a blocked artery or a ruptured blood vessel. It also contributes to transient ischemic attacks. TIAs, brief episodes that serve as serious warning signs, and increases the risk of vascular dementia, impairing memory and cognitive function over time. Kidneys. The kidneys contain a network of tiny blood vessels that filter waste from the body. High blood pressure damages these vessels, leading to reduced kidney function. This can progress to chronic kidney disease, and in severe cases, kidney failure requiring dialysis or transplantation. Eyes. The retina, which contains delicate blood vessels at the back of the eye, is vulnerable to damage from high blood pressure. This condition, known as hypertensive retinopathy, can cause blurred vision, eye hemorrhages, and even permanent vision loss or optic nerve damage. Sexual dysfunction. Adequate and stable blood flow is essential for sexual function in both men and women. Hypertension damages blood vessels and reduces blood flow, contributing to erectile dysfunction in men and decreased arousal and satisfaction in women. The widespread damage caused by high blood pressure is a powerful reminder that managing it is not just about keeping numbers in a healthy range. It's about protecting your entire body and preventing the silent but serious consequences of this condition. Now that we've uncovered the truth about it, it's time to take action. Whether for yourself or for the people you love, having the right knowledge is the first step in building a strategy to stay protected. Monitor your blood pressure regularly. Routine blood pressure checks are essential. Use a clinically validated home blood pressure monitor to track your numbers in a relaxed environment, helping to avoid white coat hypertension that can occur at the doctor's office. Be sure to follow proper measurement techniques. Rest for at least 5 minutes before taking a reading. Sit upright with your back supported and feet flat on the floor. Use a properly fitting cuff. Remain still and silent during the measurement. Record your readings consistently for long-term tracking. Lifestyle changes. The foundation for preventing and managing high blood pressure. Healthy diet. Follow the DASH diet, which emphasizes fruits, vegetables, whole grains, lean protein, and low-fat dairy. Limit saturated fats. Trans fats, cholesterol, and sodium. Reduce sodium intake. Aim for less than 200 to 300 milligrams per day, and ideally under 1,500 milligrams per day for those with hypertension. Be cautious with processed foods, canned soups, and restaurant meals. Increase potassium. Potassium helps balance the effects of sodium. Good sources include bananas, potato spinach beans, and yogurt. Exercise regularly. Get at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous activity per week, along with muscle strengthening exercises at least 2 days a week. Maintain a healthy weight. Even modest weight loss can lower blood pressure. Limit alcohol. Drink in moderation, no more than 1 drink per day for women and 2 for men. Quit smoking. Tobacco damages blood vessels and raises blood pressure. Quitting smoking significantly improves heart health. Manage stress. Practice stress reduction techniques like meditation, yoga, deep breathing, or spending time in nature. Work closely with your doctor. Always stay in contact and follow your doctor's guidance. Discuss your risk factors, understand your blood pressure readings, and take medications exactly as prescribed. Report any side effects promptly and never stop or change your medication without medical approval. High blood pressure is a silent enemy that can quietly damage your health. But the good news is, you can take control and reduce its impact if you face it head-on. Don't let high blood pressure operate in the shadows. Shine a light on it by checking your blood pressure regularly, choosing a healthy lifestyle, and staying closely connected with your healthcare team. Your heart, brain, kidneys, and entire body will thank you for the care. Take action today. Don't let your health wait. No matter your age or stage of life, managing your blood pressure, building healthy habits, and partnering with your doctor are essential steps to protect your future. Health isn't luck, it's the result of care and consistent effort. We'd love to hear your stories, questions, or personal experiences with high blood pressure. Feel free to leave a comment below. Your voice not only helps us better understand the challenges people face, but also spreads an important message about taking care of our health together as a community. Thank you for taking the time to listen. Wishing you and your family good health, lasting energy, and the strength to embrace whatever life brings your way.